Fertility level in Nigeria, according to the Nigeria Demographic and Health Survey 2008, is at 5.7%. And this implies that an average Nigerian woman can bear approximately 6 children in her lifetime. This certainly should be good news, but over the years, the number of women that die in the process of giving birth has become a source of worry. Although Nigeria's maternal mortality ratio has declined from 1,000 per 100,000 live births in 1990 to 545 maternal deaths per 100,000 live births in 2008, these figures still fall far short of the MDG number 5 target, which seeks to reduce maternal deaths by 75% in 2015.
It's a very difficult race. It's not a race that is run as a sprint, because actually this race has actually started since about 1987, when globally attempts have been made to try and reduce maternal mortality. Of recent, there has been some headway, like was said at the last International Conference of Obstetricians and Gynecologists last year, but we are still far behind. Maternal mortality is not just a medical problem, it's a social problem, it's a cultural problem. So when you look at that, you start to understand the dynamics of the roles that poverty plays, the roles culture and tradition plays, the roles in bad governance plays, the role corruption plays in maternal mortality. And when you are faced with all these problems in your society at large, translating to maternal mortality, it shows why there's a big difficulty in bridging that gap.
On the global stage, and taking a look at the Save the Children's 2013 Annual Mothers Index report, which assesses the well-being of mothers and children in 176 countries, Nigeria ranks 169, coming behind Côte d'Ivoire and Chad.
The number one killer of pregnant women in this climb is bleeding, hemorrhage. And what we're saying actually is the fact that first and foremost, to stop the bleeding, you have to give a drug that will prevent bleeding. This might not be easy to access if you are away from civilization, if you are in a remote place. But then there's a drug that the World Health Organization and then the Federation of Gynecologists Worldwide is pushing, and the International Committee of Midwives, and that's called misoprostol. They are tablets that, if taken by a woman who has just delivered, reduces the risk of bleeding. Another killer here is convulsion in pregnancy. They call it eclampsia. It's interesting how prevalent it is. I mean, if you trained abroad, you might say, for example, that in the course of your training, you never come across a patient that's convulsing in labor or before labor, but then that still happens there. But the drug of choice to control this is magnesium sulfate. And it's only in the last 3-4 years that has become regularly available to us in Nigeria.
When it is time to deliver, they don't want to come to the hospital. And we are still trying to find out why. We're encouraging them that they should come to the hospital to deliver. I don't really know the reason why they can afford to come to ANC from the beginning to the end. And when it is time for them to deliver, they just run into one quack or deliver even at home.
With just over 15% contraceptive prevalence, persisting unmet family planning needs is another undermining factor against Nigeria achieving MDG 5.
Unwanted pregnancies, women going seeking abortion, which is unsafe, which is illegal in this country, so it's been done mainly clandestinely and unsafe, leading to a lot of problems. Even a lot of my patients who I see who have even had babies, don't want other babies, still shy away from contraception. And I tell them that, like, what you're heading towards an unwanted pregnancy, which has so many challenges, because the fact that you've had 3 normal pregnancies doesn't mean the 4th one is going to be normal. So every pregnancy should be planned. A woman should take control, because she's the one who is mainly involved, not her husband. For most of the women that die from maternal mortality, some of them die, the husbands go and marry other women.
Aside from increasing reproductive health awareness, improving access to voluntary family planning services and emergency obstetric care, addressing human resource challenges at the primary care level by investing more in health workers with midwifery skills will help make pregnancy and childbirth safer for the Nigerian woman. Yomi Otaigbo reporting for Channels Television News.